Welcome to This Explainer. I'm so glad you're joining us today because we are tackling a topic that affects so many of us as we get older or just try to stay active. Today, we're diving straight into the clinical data on joint care, but we're looking way beyond just temporarily masking your pain. We're going to explore how regenerative therapies for knees and shoulders are actually aiming to restore joint function by supporting the body's natural healing mechanisms. It's truly fascinating stuff.
Okay, let's kick things off with a question that is probably all too familiar if you're dealing with joint issues. Why does the pain just keep coming back? It's incredibly frustrating, isn't it? You know the drill. You take your medication, you feel okay for a few hours, and then, right on schedule, that same ache returns. It's this endless cycle of temporary relief that leaves you wondering if there is a more permanent answer out there. Well, today we're going to look at the science of why that cycle happens in the first place and exactly how modern medicine is trying to break it.
So here is our roadmap for this explainer. First, understanding chronic joint pain. Second, the limits of traditional treatments. Third, what is regenerative medicine? Fourth, combining PRP and body growth. Fifth, treating knees and shoulders. And finally, number 6, what patients can expect. All right, starting off with section 1, understanding chronic joint pain. The sheer daily toll of joint degeneration is honestly heartbreaking. We're not just talking about some minor discomfort noted on a medical chart. We are talking about real physical limitations on your independence. Chronic pain in your knees or shoulders literally turns simple, everyday tasks into these massive hurdles. Whether it's that hesitation you feel right before climbing a flight of stairs, a sharp pain when you're just reaching for something on a high shelf, morning stiffness that takes hours to shake off, or swelling just from going about a normal routine, this mechanical breakdown affects your entire quality of life. So the crucial thing here is understanding why this mechanical breakdown actually happens. You see, healthy joints are meant to glide smoothly, and that's thanks to cartilage, which is this specialized cushion that reduces friction. And to put this into perspective, did you know that every single pound of excess body weight puts about 4 extra pounds of pressure on your knees? It's wild. So things like aging, years of repetitive mechanical stress from work or sports, previous injuries that threw off the joint's mechanics, excess weight, and chronic inflammation, all of these gradually strip that protective layer away. And as that cartilage wears down, the bones start rubbing together. Friction increases, surrounding tissues weaken, the joint lining gets inflamed, and bam, that is exactly when the persistent pain sets in. Moving right along to section 2, limits of traditional treatments. If we know exactly what's causing the pain, why do our standard care methods often completely fail to give us long-term cures? Well, conventional options like oral pain meds, anti-inflammatories, and corticosteroid injections, they primarily focus on just controlling the pain. They act like a biological band-aid to mask your symptoms, but they simply do not address the underlying degeneration going on inside the joint. Because that cartilage is still worn down, the disease usually just keeps progressing. Now, contrast that with regenerative therapies. Instead of just slapping a Band-Aid on the pain, these therapies act more like a biological scaffolding. They target the underlying tissue recovery, decrease inflammation, and actually support cellular repair. Which brings us perfectly to section 3. What exactly is regenerative medicine? The foundational tool in this approach is platelet-rich plasma, or PRP. Actually, let's look at a really important keyword here, autologous. That's a medical term meaning it's produced directly from your own biology, specifically your own blood. The process isolates and highly concentrates your platelets, which naturally contain tons of growth factors. When this concentrated plasma is introduced back into the injured joint, these natural growth factors get right to work supporting your body's healing response, reducing inflammation, and promoting the repair of soft tissues. So it's essentially your body's natural healing power, just hyper-concentrated and delivered exactly where it's needed most. So how does this translate into a real-world clinical procedure? I know it can sound a bit like science fiction, but it's actually a remarkably straightforward 3-step process. Step 1, the clinic collects a small blood sample from you, honestly very much like a routine lab draw. Step 2, that blood is processed, usually spun in a centrifuge, to separate and concentrate those crucial platelets and growth factors. And finally, step 3, the physician injects that concentrated PRP directly into your injured joint or tendon. It's a simple, quick process that sets off a highly complex biological cascade of healing. But PRP isn't the only tool in the regenerative toolkit. The source materials also detail a specialized biological treatment called body growth. You can think of body growth as a crucial secondary support system.
While the PRP brings in the growth factors, BodyGrowth focuses on the environment itself. It supports cellular regeneration, helps to slow down further joint degeneration, and significantly reduces chronic inflammation in the periarticular tissues, the tissues immediately surrounding your joint. It's working at the cellular level to improve your mobility and overall joint movement.
Now for Section 4, combining PRP and body growth.
So exactly how do these two treatments complement each other? Well, they work through distinct but paired mechanisms. PRP's primary goal is to deliver those concentrated growth factors to initiate or sort of jumpstart the body's natural healing response. Body growth, on the other hand, provides the biological support to sustain that healing by reducing chronic inflammation and promoting tissue regeneration. So think of it like this. PRP initiates the spark, and body growth provides the optimal biological environment to keep that fire of recovery burning. Together, they create a much more favorable environment for tissue recovery than either approach could ever do alone.
Next up, Section 5, treating knees and shoulders.
When we compare these two specific joints, we see some very distinct, debilitating symptoms. For knee osteoarthritis, the cartilage wear leads directly to pain while walking, massive difficulty on stairs, that awful morning stiffness, and a generally reduced quality of life. The clinical goal of combining PRP and body growth here isn't just a temporary fix, it's to support cartilage protection and actually improve your mobility. Now, on the flip side, shoulder degeneration causes persistent pain when lifting your arm, severe weakness, and often the inability to even sleep on your affected side because of inflamed soft tissues and tendons. Here, the combined therapy aims to support that specific tendon healing, cool down the inflammation, and finally allow patients to regain comfortable movement.
And that brings us to our final part, Section 6, what patients can expect.
Okay, the absolutely crucial point on this timeline is understanding that regenerative medicine relies on biology, not artificial suppression. Look, if you take a painkiller, you feel it in 30 minutes, right? This is very different. On day 1, the treatment is administered, and while routine daily activities are generally totally fine, you aren't going to be running a marathon. In fact, through week 1, patients often experience temporary mild soreness, which totally makes sense. You are purposely initiating an inflammatory healing response. That soreness generally subsides within a week, but the real magic happens over the following weeks and months. Because this relies on your own cellular healing, improvement develops steadily and gradually as those tissues continue their natural repair processes.
So who is this actually for? Well, this evidence-informed option is generally considered for individuals who have mild to moderate knee osteoarthritis or chronic shoulder pain tied to degeneration. Crucially, it's for patients whose symptoms are persisting even after they've tried conservative treatments, like physical therapy or basic medications. It is specifically designed for folks who fiercely wish to maintain an active lifestyle and are really hoping to delay or maybe entirely avoid joint replacement surgery, assuming it's deemed clinically appropriate by a physician after a comprehensive evaluation. We've explored how joint degeneration happens, why traditional methods fall short, and the genuinely fascinating science behind combining PRP and body growth. This approach doesn't promise some magical overnight cure, but it absolutely offers a biological pathway to genuinely support tissue healing rather than just covering up symptoms day after day. So I'll leave you with this provocative thought. If your joint pain keeps returning, is it finally time to stop simply masking the pain and start actively supporting your body's natural repair process? Thank you so much for exploring this fascinating topic with me in this explainer. Until next time, stay curious and stay active.